Hello friends, welcome to Love Medics. Let's think. Our heart is beating. It pumps the blood to all parts of the body with the help of blood vessel. That is called human blood circulation. And also, once we are a cute fetus or embryo in our mother's womb. In there also, our heart is beating. It pumps the blood to all parts of the body with the help of blood vessel. Are these two circulations are same? No. Then what is the circulation is? Fetal circulation. Contents of the video: introduction, umbilical cord, shunt, pathway, oxygen exchange, cardiac output, remnant, and changes of the remnant. Fetal circulation introduction. Fetal circulation is the circulatory system of the fetus. It is also known as fetoplacental circulation. Fetoplacental circulation. It includes umbilical cord and blood vessel in the placenta, and it carries the fetal blood. Before that, we should know the human blood circulation. First, the deoxygenated blood carried from all parts of the body by superior vena cava, inferior vena cava, and coronary sinus. This deoxygenated blood drains into right atrium, and this blood passes into right ventricle through tricuspid valve. When the pulmonary valve opens, the deoxygenated blood passes into pulmonary trunk. This trunk delivers the deoxygenated blood from the right ventricle to lung. In lung, the deoxygenated blood converted into oxygenated blood by oxygen exchange, and the oxygenated blood again back to the left atrium, and this blood passes into left ventricle through bicuspid valve, and from here the oxygenated blood delivered to all parts of the body by aorta. That is human blood circulation. What is the connection between mother and the fetus? That is umbilical cord. Umbilical cord has two umbilical artery and one umbilical vein. Normally, the artery carries the oxygenated blood. Vein carries deoxygenated blood. But here, the artery carries deoxygenated blood to the placenta. In that blood, the fetal waste and carbon dioxide are present. Umbilical vein that carries oxygenated blood and nutrition to the fetus. This red color is umbilical vein, and the blue one is umbilical artery. Shunt. Shunt means what? Shunt means diversion. Diversion of the blood going to happen with ductus venosus, ductus arteriosus, foramen ovale. Ductus venosus connect the umbilical vein and inferior vena cava, and ductus arteriosus that connect the pulmonary artery and aorta, that is ductus arteriosus, and foramen ovale, that is the opening that connect the right atrium and left atrium. Pathway of fetal circulation. First, the oxygenated blood carried from the placenta by umbilical vein. That umbilical vein delivers the oxygenated blood to inferior vena cava through ductus venosus, and that blood passes into right atrium. Here, the blood is diverted to right ventricle and left atrium. From right atrium, the blood is passes through the foramen ovale, that is the opening between right and left atrium, passes into left atrium. From the right ventricle, the blood is passed into pulmonary trunk, and then that is passed into lung, and From the lung, the blood is carried by pulmonary vein and passes into left atrium. And here the left atrium delivers the blood to left ventricle, and that blood delivers into aorta. From pulmonary trunk, the blood also passes via ductus arteriosus and it directly reaches the aorta. And that blood passes into systemic circulation and delivers the oxygen to the fetus, and then it carries the deoxygenated blood to the placenta through umbilical artery. Again I repeat, from the placenta, the oxygenated blood passes into fetus and it delivers to ductus venosus and it passes to inferior vena cava. The blood is passed into right ventricle and left atrium through foramen ovale. Here the blood is passed into pulmonary trunk and it reaches the lung, and then it again back to the left atrium, and here pulmonary trunk is present, right? This blood directly diverted into aorta with the help of ductus arteriosus, and that blood delivered to all parts of the body. And from the left atrium, the blood is passed into aorta and it delivered to all parts of the body. Again the deoxygenated blood carried by the umbilical artery and it delivered to placenta. This is the fetal circulation. This is the umbilical vein and these are the umbilical artery. This is ductus venosus. Here ductus arteriosus is present and here foramen ovale is present. Oxygen exchange. From the fetus, from the mother, the oxygenated blood is exchanged to fetus by placenta. Oxygen exchange is present in the placenta. From maternal surface, the oxygens are transferred into fetal blood circulation. Fetal hemoglobins are more affinity to attract the oxygen. So, the fetal blood that more affinity to oxygen, so it absorbs more oxygen from the maternal circulation and it delivers to fetus. Cardiac output and heart rate of the fetus. Heart rate 120 to 140 beat per minute. Cardiac output before delivery 350 ml per kg per minute. After delivery 500 ml per minute. Lung, that is a low pressure system. And then after delivery increase atmospheric pressure that causes lung to inflate. After delivery we clamp the umbilical cord and cut the umbilical cord. So the atmospheric pressure is increased. So that atmospheric pressure the baby to inflated heart. The first breath of the fetus is taken while the baby is crying after delivery. Remnant. The ductus arteriosus anatomically, structurally closed 2 to 3 weeks after delivery, and functional closure of the ductus arteriosus 10 to 96 hours after delivery. Ductus venosus, structural closure of ductus venosus is 3 to 7 days after delivery of the baby, and functional closure of the ductus venosus is immediate after delivery. Foramen ovale, that is structurally closed after 1 year, and functional closure of the foramen ovale is after delivery. Changes between fetal circulation and adult circulation, that is a remnant. Ductus arteriosus, that is converted into ligamentum arteriosus. Ductus venosus, that is converted into ligamentum venosus. Here the ligamentum venosus is present. Foramen ovale, that is converted into fossa ovalis in adult heart. Umbilical artery, that is converted into umbilical ligament. Umbilical ligament. Umbilical vein, that is converted into ligamentum teres. This is the ligamentum teres. Fetal circulation overview. The oxygenated blood, that is carried from the placenta by umbilical vein to the fetus, and it passes into liver, and then the deoxygenated blood from the portal vein also passes into the liver, and then the blood is passed into ductus venosus, and that is connected with inferior vena cava. That blood is passed into right atrium, and then through the foramen ovale the blood is passes into left atrium, and then that blood is passes into left ventricle, and then it passes into ascending aorta, and it delivers to all parts of the body. From right atrium the blood also passes into right ventricle. It passes via the pulmonary artery and it reaches the aorta by ductus arteriosus, and that is passed into hypogastric artery, and then the deoxygenated blood carried by umbilical artery, and then that deoxygenated blood delivered to placenta. Question time. Fetal circulation is the circulatory system of fetus. Anatomical closure of ductus arteriosus is 2 to 3 weeks after delivery. Fossa ovalis is a remnant of foramen ovale. Thanks for watching.